So my name is Tara Moreno, and I'm the Executive Director of the Serenity House of Flint. And what we are is a recovery community organization that advocates on the current public health crisis of addiction, as well as inform the public on holistic options for recovery. And holistic meaning Reiki, yoga, auricular acupuncture, guided meditations, mindfulness. So I'm here to introduce you guys to Reiki, or maybe further your knowledge of Reiki. How many people have heard of Reiki? Awesome. Okay, great. So Reiki is an incredible modality, and I'm seeing really amazing things with it. I've been a Reiki master for almost 3 years now. So I have a private practice in which I deliver Reiki to my clients, and I also manage the Serenity House of Flint. So what I'm seeing, though, with Reiki is incredible results. I'm seeing a complete relief of things like sciatica, bipolar disorder, anxiety, depression, a lot of more of a mental and emotional component than physical, but it does help the physical. So I'm going to talk about Reiki and how we can become aware of it, how we can get the information about what it is and how it can help us. Integration, how we can integrate it not only into our clientele, but into our own lives. And what it will do as a result of the integration. So what is Reiki? So Reiki is an ancient practice. This is not new. It's been around for thousands of years. So it is a modality that was discovered by a gentleman by the name of Mikao Usui. So Usui wanted to figure out, okay, how was Jesus able to heal people? So I don't really want to get into the spiritual aspect so much of it, but this is the history of Reiki. So what he did is he started his search and was essentially the first person to be able to utilize Reiki and start to heal people. So Reiki is pronounced Reiki, and it's a combination of two Japanese words, Reiki meaning universal life energy. Reiki is it's a complement to traditional medical care. So this is not something that's going to replace. It's going to work synonymously with what we're already doing in the Western medicine model. And it addresses physical pain, mental and emotional disorders. Reiki is an energy medicine. So energy medicine is an all-encompassing term for things like acupuncture, healing touch, meridian therapy, cranial sacral therapy, qigong, which is actually moving energy across the body. So it's a plethora. We have a plethora of energy medicines, and these are just a few, with Reiki being one of, in my opinion, the most important one. So according to the American Hospital Association in 2007, about 15% or 800 American hospitals offered Reiki in their programming. So we're going to talk about this a little bit later, but Beaumont Hospital uses it, and I just found out that Pontiac, a hospital in Pontiac, uses it too. So what we really want to do, Serenity House of Flint, is bring it to our hospitals or our doctors so that we can begin to help people and see relief. So what is it exactly? So according to the National Institute of Health, Reiki is an energy medicine or form of touch therapy, and it's facilitated by very light touch, or hands can be hovered above the body. It is classified or can be classified as a spiritual or vibrational healing, depending on what you relate to as your own personal practice. Reiki is a healing practice, and I want to drive this home. It's a healing practice. It's not a cure. So it is something that's done. Typically you can feel better once you start it, but to get the big shifting to happen, it's a daily practice, or it's regular treatments for clientele. Reiki promotes balance in the body. So balance in the body. All doctors know that to create homeostasis in the body has to be relaxed. So Reiki creates relaxation in the body so that the body can begin to become in balance or self-correct. So Reiki is whole person care too. So it's mental, emotional, physical, and spiritual if you have a spiritual practice. So what are the benefits of Reiki? There's so many, but it's increased relaxation. It helps with pain management, anxiety, depression, digestion, and then substance use disorder, which is my specialty. Enhanced well-being, you'll just feel better. Improved sleep. After I have, typically my clients, when they come to see me after the first session, they'll sleep great that first night. So my clients also have shown greater self-esteem, greater self-awareness, and self-agency. So one of my clients came to me after having a really traumatic experience, essentially trying to end her life. And she came to me for her first session, and she was so amazed at the results that she told me, she said, I went home and I took a shower. And that for her was a really, for me too, a really big shift. That was after the first session. It also helps with accelerated surgical recovery, reduces side effects from medication therapy, chemotherapy, and radiation. And it also can heighten your intuition, so that gut feeling or that, that compass that guides us during our life. Process of our life. So Reiki, learning Reiki. So Reiki has 3 levels. So there's 1, 2, and 3. 1, the whole foundation of Reiki is self-practice, right? So I want to drive this home. When we are helping people, we tend to overexert ourselves, and we try to give from an empty cup a lot of the time, so depletion. So what Reiki teaches is to fill your own cup up so that you can help people with the overflow. So self-healing, self-practice is the foundation of Reiki 1. After I attune people to Reiki 1, I tell them 30 days of self-healing. So you get that time to honor yourself and really connect with that inner self. Reiki 2, that's an extension of 1. So Reiki 2 is really cool because it further deepens the practice, and it deals with a lot of the mental body. So it deals with your belief systems, like knowing and feeling that Reiki can be delivered from a distance. So it really, for me, it has deepened my trust of self. So Reiki 3 is for the student who wants to become a teacher. And this is for a person that is interested in passing along attunements, which the attunement is like an initiation, right? So it's a combination of symbols and a passage of like energy. So the Reiki principles, there are principles that we live by as Reiki practitioners that guide us in our daily lives. And they're listed right here, and they are: just for today, I will not worry. Just for today, I will not anger. Honor your parents, teachers, and elders. Respect the oneness of all life. Show gratitude and make your living honestly. So it's a really basic outline to have essentially a good and honorable life. Reiki classes, typically, they can be taught in one weekend, although I don't do that. I want to make sure that when my clients are taught Reiki, that they have that 30 days of self-healing and they're acclimating to the energy, because when you're attuned, there's changes that happen in the body, and there's a shift. And the cost of learning Reiki, it depends on the teacher, but they can range from, I've seen $100 for Reiki 1 up into, I've seen thousands of dollars. And in the past, a Reiki Master attunement cost $10,000 in America. This was like in the 80s. Yeah, yes. So how does Reiki work? The truth is we don't really know how it works, but we do know that it encourages, like I said previously, homeostasis or balance in the body. So the body will begin to self-correct. The hand positions of Reiki are located near the endocrine system or the glands of the body. So, we're looking at like the pituitary gland, the pineal gland, we're looking at the thymus, and the reproductive organs. So all these specific hand positions hover over these glands of the body. And nerve plexus areas, so where the nerves, come together in clumps or in big places in the body. So we also know that the human body emits low-level light, heat, acoustical energy, and has electrical and magnetic properties. So the brain and the heart are kind of electrical, stimulated by electrical processes. Okay, so Reiki sessions vary. Reiki can be used in many different settings. So for Serenity House of Flint, we do a lot of events. So we see a lot of people, and we'll do like 5 or 10 minutes per person, and we'll just lay hands on multiple people. And this is like for events like our walk and our rally, our arts and our music show. We partner with a lot of other organizations to provide we call them mini Reiki sessions. But a regular Reiki session is about an hour. And what happens is the client will lay down on the table, and they will be fully clothed on their back, and we will lay hands, like I said, at the nerve plexus areas. So, but before I lay hands, or my students lay hands, what we want to do is, when the client comes to us, we don't really have a perception that anything's wrong with them. We really don't want to focus on that part. We want to be able to provide a safe container for them to not feel like they're broken, right? To have some sort of peace in their lives. So in order to get a significant shift in the clients, what I'm seeing is that they need to have at least 3 to 4 sessions, 1-hour sessions once a week for a month. Again, what I'm seeing after the 4th session in my clients is an eradication and the really awesome miracle clients, eradication of bipolar disorder, a complete eradication of sciatica, lower back pain is gone. These are really, really significant shifts compared to where they were. They will come to me and they will be just emotional, upset, crying, and then when they come in at the 4th session, it's like almost like a totally different person. They're smiling, they're noticing the differences, and wondering too, is it the Reiki? Is it the energy medicine? Questioning. So I encourage them to write down their experiences and journal, because they have to be able to kind of have a before and after picture for themselves. So sessions cost between $45 to $70 for me, but we get into some of the other practitioners, and I've seen it all the way up to there's a gentleman in Ann Arbor, his name is Master Kim, and he's charging $250 per session, and he has a wait list for 9 months. So after the session, I encourage, it's like medication therapy. So I let my clients know they have to sign a release form stating that they understand that detox symptoms could be present after the treatments. So there could be an aggravation to the system, and I encourage that it's a healing crisis and it's temporary. So they may have like gastrointestinal release, weird dreams, but that's just the negative, as I call it, leaving the body. So symptoms may occur, like I said, mental, physical, and emotional. It's really important that they understand that, because they can kind of get like some fear, like, I don't know this, and I've had clients that would be so afraid that they wouldn't come back because the shifting started and they didn't finish or complete. They weren't ready for the shift. And, speaking on that, seeing people who are in intense pain and who are suffering at that level, the irony of it is they tend to want to hold on to their suffering, because who would they be without the suffering? Because they've been in it for so long. So Reiki really tries to bust through that, to get them to a place to feel safe in themselves and to a new path for their life. Reiki, I make sure that the communication that I have with my clients is always open. They can text me, they can reach me on my Facebook Messenger, just because this significant shifting that could happen as a result of the treatments can be really pronounced. So I want to make sure that they understand that they're safe. So who could benefit from Reiki? So when I started Serenity House, I'm like, well, we're just going to get together and we're just going to go out to the hood and we're just going to start laying hands on everybody to get them to feel better. But the more I grew and the more I started to do this, I was like, I don't know if that's the path, because really the pathway is to get the people who are dealing with this population, have them become aware of what it is, right? Because this can be utilized in all of your practices, because Reiki energy is, you can use it, you don't have to have them on the table, right, for an hour. You can just kind of invoke it while you're sitting, talking with the client, right? So it's kind of like an intelligent energy. It's an intelligent thing that comes through. So these are evidence-based studies. So before we get into the studies, I just want to say that there's very little studies that have been done on Reiki. And that's because it's kind of like a hit or miss thing. So Reiki is kind of dependent on that self-practice that I was talking to you about. So not all Reiki practitioners are kind of created equal. Like, you want to get the practitioner who's really honoring that themselves and really working on themselves. And I kind of compare it like, if you want to quit smoking, you're not going to go to somebody who's smoking, right? So you're going to want somebody who's working on themselves, who's really, invested in themselves. So this is the first study. So this study was done by Deborah Bowden, and she did a lot of the studies that I found on our peer-reviewed in the peer-reviewed articles online. But this was a small study, so it was about 40 university students who were given Reiki, and half had high depression or anxiety, and half had low depression. Now, they randomly received Reiki. Each received 6 30-minute sessions over a period of 2 to 8 weeks, and they weren't aware if they were receiving Reiki or not. But the results were that the patients who had high anxiety or depression who received Reiki showed a progressive improvement in overall mood. And after a 5-week follow-up, with a questionnaire, participants were significantly better in the control group. Now, this is evidence-based study 2. So this was done in a cancer infusion center in a hospital in 2012. So this was a little bit of a longer study. So it was 6 months where adults received Reiki from the volunteer services in the hospital. So they responded on a 5-point scale on pain, mood, distress, sleep, and appetite. And of the 145 surveys completed, with 1/3 of the participants being in the cancer part of the hospital, and the rest of the patients were in other parts of the hospitals, they reported 94% improvement in their overall well-being and 93% other parts of the hospital. So I'm going to show you the graph here. So it's, I mean, the relaxation, you know, that's a given with the Reiki, but to really get to the anxiety and the worry and the improved mood, that's still, the numbers are pretty impressive. Now, like I said, pain is lower on the scale. Typically, it's the emotional and mental bodies that get impacted first, and then the physical body will get the improvement later. And this is the third study. Now I put this in here because I really want to drive home the fact that clinicians and people dealing with the population, that is one of the most important things that we need to look at, because it's back to the cup, right? You want to make sure that you have a full cup. So this was for nurses on work-related stress in 2010. So it was a perceived stress test. Stress tool was administered to the nurses prior to taking a Reiki class. This was a small study, but 17 nurses did a follow-up questionnaire and showed that they had reduced perceived stress levels. And we all know that stress is the #1 killer. So those are our studies, the studies that I chose. Now, Serenity House is in the process of working with the University of Michigan, Ann Arbor, and we're going to do our own study. So we just wrote for a $5,000 seed grant so that we can come in and figure out through focus groups how are we going to measure the outcomes, and then we're going to do an intervention. So I'm actually going to do an intervention on a select group of people in our community to show its efficacy. So who offers Reiki at this time? Reiki is it's new to our area, but it has been around for a while. We have Beaumont Hospital, and Beaumont Hospital has had, for 11 years, they've had it in their oncology unit. They actually attune 1, 2, and 3. Johns Hopkins uses it in their Integrative Medicine and Digestive Center. Henry Ford just recently implemented a Reiki program. The U.S. Medical Army uses Reiki in their Warriors Stress Combat Reset program. Dr. Oz is a really big proponent of Reiki. He actually uses Reiki in his surgical rooms. And a woman by the name of Pamela Miles has been really instrumental in moving Reiki, medical Reiki, they call it. And then in non-hospital settings, so right now in Flint, you get a lot of like the holistic centers and like even like some of the metaphysical shops will offer it, but we're not seeing it in any of the hospitals. We're not seeing it in any of the doctor's offices yet. We're not seeing it really anywhere. So Serenity House of Flint, like I said, is, and I have pamphlets up here too for you guys. For more information, but so that's what I'm doing, is trying to get people aware of what it is and how it can help immensely. That's my works cited.